Assalamualaikum and hi everyone. Welcome to lesson 4, Delirium. What is delirium actually? It's an acute fluctuating syndrome of altered attentions, awareness and cognition precipitated by an underlying conditions or event in vulnerable person. So, delirium is frequently described using terms like altered mental status, acute confusional state, sundowning, encephalopathy, and acute organic brain syndrome. In Diagnostic and Statistical Manual of Mental Disorder 5 editions, or we call it DSM-5, is a manual for assessment and diagnosis of mental disorder and does not include information or guidelines for treatment or any disorder. That said, that determining an accurate diagnosis is the first step toward being able to appropriately treat any medical conditions, and mental disorder are no exception. DSM-5 is also helpful in measuring the effectiveness of treatment, as dimensional assessment will assist clinicians in assessing changes in severity level as a response to treatment. They have 5 coding: A, B, C, D, and E. A is a disturbance in attentions, reduced ability to direct, focus, sustain or shift attention, and awareness. That means reduced orientation to the environment. Is the disturbance develops over a short period of times, usually hours to a few days, and represent a change from baseline attentions and awareness, and tends to fluctuate in severity during the course of the day. C, an additional disturbance in cognition. They include memory deficit, disorientation, language, spatial ability, and perception. While in D, the disturbance in criteria A and C are not explained by another pre-existing, established or evolving neurocognitive disorder and do not occur in the context of a severely reduced level of arousal such as coma. And in criteria E, there is evidence from the history, physical examination or laboratory finding that a disturbance is a direct physiological consequences of another medical conditions, substance intoxication or withdrawal, or exposure to oxytocin, or due to multiple etiologies. What are the predisposing and precipitating factors? The predisposing factors may include: in elderly patients, dementia is the most prominent risk factor, being present in up to a 2/3 of the all causes of delirium. Others include several medical illnesses, depression, alcoholism, poor functional status, inactivity, malnutrition, male gender, hearing or visual impairment, and social isolation. For precipitating factors, namely include drugs, infection, metabolic disturbance, structural upset, central nervous system and pulmonary insults, and retention problems. For physiotherapy assessment, clinically in delirium, patient may be hyperactive or hypoactive or mixed. In geriatric delirium, most susceptible manifestations include new onsets incontinence, falls or refusal to mobilize, dysphagia, dysarthria, mild disorientation, and slowing in the speed of mental processing. Also, the detailed history of the mental status change and identification of potential disposing, precipitating or fluctuating factors such as recent medication changes or sign of medical illnesses is an utmost significant. The confusion assessment method is the most effective tool in identifying delirium, and also the physical examination should be comprehensive and should include a careful search for cardiorespiratory, neurologic, and infectious disease. Physiotherapy treatment, the mainstay of treatment remains the diagnosis and treatment of the conditions predisposing to, precipitating or perpetuating the delirium, medication, physical illnesses, and if needed, pharmacological therapy is the form of minimal possible dose of antipsychotic drugs may be used. The non-pharmacological measures are of immense help and including measures like reducing noise, providing soft lighting, clocks, calendar, orienting the patients to time and place, correcting sensory deficit with eyeglasses and hearing aids, and increasing the patient's sense of control. That's the end of our presentation. Thank you everyone, and don't forget to scan this QR code to taking your quiz and practical session. Thank you.